I could look at the camera. I could just see
Okay.
what we're doing.
Okay, go ahead.
Hi, I'm Dr. Conroy here at Animal Care Clinic. So, got a tough case here. Sweet little pup. Pretty sad case, but I'm hoping we can fix this up. So, we have a couple of significant issues. Aside from some superficial wounds that have already been addressed, we were covered in ticks. And as we all know, ticks can transmit tick-borne disease. So, priority number one is get the ticks off, treat for that, and then we're going to empirically treat for Lyme disease and other tick-borne diseases, just assuming we have those. The biggest issue at hand is at this point we're not ambulatory, meaning we're not walking, because we have fractures of both of our rear legs. And the fractures, this is the femur. On one side we fractured right here, so the bones are actually displaced. And the other fracture is what we call a Salter-Harris fracture, which is of the growth plate. So this piece of bone right here is actually fractured and back here. And then on the front, we have a fracture of the radius. So their bone is identical to ours. So they have a radius and they have an ulna. And both those are fractured. So priority number one is we need us to get back on those front legs. So what we're going to do is we're going to put a bone plate on the radius and allow that to start healing. And then that way, once that heals, we can have some weight on the front leg. And then from a priority standpoint, we're going to do one of the rear legs, and we're going to do that fracture where the bone is pulled back. Because I need us back on that leg, because the longer that fracture sits back here, it's going to be harder and harder for us to fix that. And that's ultimately going to affect our ability to walk. The outlying question that we don't know yet is there any neurologic damage to those back legs? So that's kind of a time will tell type thing. But our goal and priority right now is we have to stabilize those fractures, treat for the tick-borne disease, focus on nutrition, make sure we're urinating properly, and hopefully this is a good recovery. But sad case, but I'm optimistic we'll make this little pup better. So everybody cross your fingers.